I'm Dr. Lawrence Jenkins. I'm from Columbus, Ohio, working for The Ohio State University Wexner Medical Center. I specialize in men's sexual health and infertility, mainly penile implant surgery and vasectomy reversals. So I'm in Seoul, Korea to join a crew to do a penile implant course for the Society Internationale de Urology to teach other urologists on penile implants. Yes, in the United States, the demand for penile implant surgery is going up, and it's really related to erectile dysfunction and implant surgery being more accepted nowadays as an option and safe option for patients to use. Not many patients know about penile implant surgery. I'd imagine only probably 10 to 20% of the patients who actually come through actually know about it. The others, they learn once they have a session with me. As a doctor, I think it really relies on patient education. For me, I try to do as much as possible as far as getting out in the community, doing talks, educating the primary care providers to let them know that there's options, and letting them know, just if patients have questions, feel free to make an appointment with me. I got into prosthetic surgery to really try and help patients. A lot of my training dealt with cancer treatments, and a lot of the treatments that we use for cancer, the surgeries, cause erectile dysfunction in patients. And sexuality is a big part of people's lives, and helping them get that part back, making them happy and getting them a sense of normalcy after their cancer care, that's really my goal in helping them and making them happy. I mean, I've had several memorable patients. It's always the patient who comes back. They had probably low expectations, and they're just amazed at how wonderful and how much freedom and how they're able to use the implant whenever they want, for as long as they want. They're just so happy coming back afterwards. One patient comes to mind. He was in his late 60s. He was being treated for prostate cancer and had a prostatectomy. He worked manual labor. He worked in a warehouse. So he suffered from erectile dysfunction for a couple years before he actually came in to seek treatment. And he was really kind of depressed because, that loss of manlyhood. And we were able to successfully do a penile implant. And seeing him back post-operatively, he came in with a smile on his face. It was just such a difference, such a change. He was very happy. Well, of every patient, I'm going over their past surgical history, their medical history, thinking of what challenges I may have come across, what makes this case different from every other case, and what techniques I may have to do to really make it case go perfectly. A good doctor is one who's able to treat his patients, make their care as optimal as possible, because we can't cure everybody, but to do the best that we can. It's my personal goal to educate my patients to make sure they understand what's actually going on with them. And I feel if once they understand it, they're able to get empowered to take on their own care themselves. So I plan on continuing to grow my practice. One of my main forces is patient education. So getting out in the community, creating videos to educate patients that there's options out there, to try and get a larger audience of patients who know that their life can change and they could be happy again after their previous cancer surgery.